Hi, my name is Sarah Brown and this is my pitch for a project on the topic of the inter-hospital transfer of critically ill children. The question I propose to investigate this further is, does an increase in length of time to admission to a paediatric critical care environment result in increased resource utilisation and length of stay? Despite the vastness of Australia, there are limited paediatric intensive care units across the country. This model ensures sufficient throughputs for each facility to maintain an appropriate level of clinical skill. However, sick children will continue to present to their local facility, either via private transport or ambulance, and these facilities are unable to provide the definitive care they require, and so the child will require a retrieval. There is limited research conducted on the effects of inter-hospital transfer of paediatric patients within Australia. International research based in similar healthcare environments with similar resources as here have found negative effects on outcomes, including increased resource utilisation, such as episodes of ventilation and duration of ventilation, and increased length of hospital stay. Also, the length of wait time at the referring hospital, as well as the length of the transfer itself, have been shown to affect patient outcomes. Australia is a big country, and so children often have to wait a significant time for a retrieval to a PICU, and this is often a lengthy process in itself. Despite this increased time to definitive care for our more remote children, there is real positive research on the first time to contact with an intensive care team and patient outcomes. Current models of paediatric intensive care are changing as healthcare services recognise that one tertiary centre may no longer be able to meet the needs of the population it serves. Some health districts are now working collaboratively to provide a hub and spoke model of care, providing multiple facilities under the same governance structure. And I wonder if now is also the time to move towards a similar model for retrievals to shorten distances and lengths of transfers, as well as wait times at referring hospitals. My research will include a cohort study of all admissions to multiple PICUs over a 2-year period, with an independent variable of length of time from presentation to the referring hospital and admission to a PICU. Dependent variables will include length of stay and resource utilisation. Consideration will need to be given to the diagnosis of the patient, as this will also affect predicted outcomes. Non-identifiable data will be collected on the variables from each facility's database, hopefully reducing the need for consent and simplifying the ethics approval process. This research will potentially benefit the children and families requiring transfer to a PICU, reducing length of stay and possible interventions. Benefits will also be seen across a health service, including an increase in PICU bed days and more appropriate resource utilisation, enabling each team to retrieve only the patients appropriate for their healthcare facility's scope. Thank you.